Hey everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about how to place implant in maxillary anterior region. It's a clinical case in which I'm going to show you how to place an implant in a maxillary anterior region and how to do a treatment plan before placing the implant. Okay, then let's begin the video. So this is we have a case. As we all know, the anterior maxillary region in the mouth has been of major aesthetic concern for dentist and for the patient. So we have to know how to choose an implant and how to place an implant and the correct angulation, because maxillary anteriors are at angulation. So we have to follow that angulation to maintain the aesthetic and the smile of the patient. Treatment planning is very essential in case of maxillary anterior. For the success of the implant in the maxillary anterior region, we have to stick to four major concepts. First, implant should be in appropriate position in mesiolingual, distolingual and apicocoronal dimension. An implant should be placed in correct angulation and of correct size. Very important. So how to select implant width? So suppose we are going to place an implant in the central incisor. So there should be a minimum 1.5 distance between the root of the natural teeth and the dental implant in mesiodistal dimension. So from both the dentition, from the central and the other side from the lateral incisor, we should have 1.5 mm, 1.5 mm distance between the teeth root and the implant. You can see in this we have a wider space for the implant, so we can select wider width implant. And then how to select a height, as we have a ideal idea about the central incisor root length. So according to that we can select the length of the implant, or by seeing the radiograph we can select the length of the implant. Now we are going to start a surgery. We are using a flapless technique, so we are not going to raise any flap. So we'll start our osteotomy with first drill, which is in this case is 2.3 mm in diameter, as you can see in the video. Now we continue the drilling sequence with 2.8, 3.5, 3.8 and 4.4 mm drill. So we are going to use a 4 size drill in this case because we are choosing a wider implant. After completion of drill, now we are going to place an implant with handpiece of size 5 into 11.5 into the drilling socket. Because of the width of the implant is 5 mm, we are going to use a last drill 4.4 mm, so that implant will be snugly fit. Now we are going to further tighten the implant with the help of torque ratchet so that we can maintain the torque. As you can see in the video, we are using a torque ratchet with hex at the apex. After placing the implant, now we are going to take a post-operative IUPA to check the angulation and the placement of the implant. And then we are going to attach the cover screw or a healing abutment at the top of the implant. In this case, apicocoronally we don't have enough bone to engage, so we are going to place implant 2 mm palatally to engage the palatal bone. After attachment of healing abutment, post-operative instruction were given to the patient, and then we'll recall the patient after 1 week for follow-up. And always remember, patient must have to wait for 4 months for the bone to grow and heal around the implant for prosthetic rehabilitation. In maxilla, we have to wait for 4 to 6 months, and in mandible, we have to wait for 2 to 3 months for the prosthetic rehabilitation. This is we have a post-operative IUPA. As you can see in this IUPA, we have at least 1.5 mm distance between the root of the adjacent tooth and the implant. It can be more than that, but not less than 1.5 mm. So 3 points you have to remember while you are going to place an implant in maxillary anterior region. First, at least 1.5 mm distance between the implant and the root. If it is less than that, there is no or minimum bone between the implant and the adjacent tooth, and the chances of the failure of the implant is more. Second, we have to engage either palatal or apicocoronal bone, not facial, because facial bone is very thin. If you are going to or try to engage facial bone, there is a chances of dehiscence of implant and again implant failure. And third point is to remember the angulation. Maxillary anterior have 5 to 10 degree angulation. If you're not going to follow the angulation, aesthetic will be compromised. I hope this video is helpful for you to understand how to place implant in maxillary anterior region and how to do a treatment planning before placing the implant. If you have any problem related to this topic or any other topic, you can comment on comment section. And yeah, don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest update.